Welcome back to Med School Radio. This is Simon, and I am reading the summaries which were presented from the first aid questions. It's a great way to review, so I recommend that you do it yourself. Thanks for joining me. Let's enjoy listening to these summaries. Hashimoto thyroiditis is an autoimmune disease that destroys the thyroid gland. It is associated with high serum concentrations of antithyroglobulin and anti-thyroid peroxidase autoantibodies. Hashimoto thyroiditis manifests with signs and symptoms of hypothyroidism, including cold intolerance, fatigue, weight gain, depression, weakness, hoarseness, diminished reflexes, bradycardia, dry and cool skin, and coarse hair. Its characteristic histopathologic findings include lymphocytic infiltration with well-developed germinal centers and Hürthle cells. Phosphatidylcholine is the main component of pulmonary surfactant, which helps keep alveoli from collapsing at the end of expiration. It is not produced in adequate amounts until the 36th week of gestation, increasing the risk of NRDS in premature infants. Hemochromatosis is a disease of iron overload, leading to end organ damage. It is characterized by micronodular cirrhosis, new-onset type 1 diabetes, and hyperpigmentation. The disease may be hereditary or secondary. The most effective treatment is removal of units of blood periodically to reduce the amount of iron in the body. Following central nervous system injury, astrocytes are the primary cell that is active in gliosis at 1 to 2 weeks and in formation of the resultant glial scar 1 to 2 weeks after the event. Dopamine beta-hydroxylase deficiency can manifest at birth with symptoms of vomiting, hypotonia, and hypotension. It can also present later in life and is characterized most commonly by orthostatic hypertension. Epinephrine acts non-selectively on all adrenergic receptor subtypes. When administered alone, it increases systolic pressure via alpha receptors and decreases diastolic blood pressure via beta receptors. When a non-selective alpha blocker, such as phentolamine, is administered first, epinephrine acts only at beta-2 receptors and reduces diastolic blood pressure, thus decreasing mean arterial pressure. Dantrolene is a drug that inhibits the release of calcium from the sarcoplasmic reticulum of skeletal muscle. It is the only known therapy for malignant hyperthermia. When sentinel events occur, such as mistakes that lead to the death of a patient, a root cause analysis is conducted in order to identify the mistake and prevent it from occurring again in the future. A fishbone diagram, which visualizes contributors to a never event, is a useful tool to help guide the root cause analysis. Oral candidiasis manifests with white, scrapable plaques in the oropharynx and often occurs in patients who have an inadequate immune response. Individuals who are immunocompromised as a result of HIV infection or diabetes mellitus are at increased risk for oral candidiasis, as are transplant recipients and patients receiving immunosuppressive therapies such as corticosteroids, which reduce transcription of inflammatory cytokines. Metoclopramide is a pro-mobility agent and the first-line treatment for gastroparesis, which presents with nausea, bloating, and gastric retention. Phenoxybenzamine is an irreversible alpha-1 and alpha-2 receptor antagonist used first in the treatment of a patient with a pheochromocytoma to control blood pressure. Without adequate alpha receptor blockade, the patient is at risk for an intraoperative hypertensive crisis. Propranolol is a beta receptor antagonist that is used after the administration of an alpha receptor antagonist. The first-line treatments for erectile dysfunction are phosphodiesterase 5 inhibitors, such as sildenafil, which increases cGMP levels by inhibiting the degradation of cGMP to GMP by phosphodiesterase, prolonging cGMP action. Verapamil decreases calcium conduction during phase 0 of the nodal action potential, delaying atrial depolarization rates. Such a delay can lead to uncoordinated firing of AV and SA nodes, leading to complex dissociation and AV block. Delirium tremors are one of the latest physical manifestations of alcohol withdrawal and usually appears at least 48 hours after the last consumption of alcohol. The blood-brain barrier acts as a permeability barrier in the CNS and is composed of capillary endothelial cells with tight junctions, basement membrane, and the foot processes of astrocytes. Damage to the blood-brain barrier can lead to vasogenic edema, increasing ICP. Under normal circumstances, dopamine cannot cross the blood-brain barrier, but its precursor L-DOPA can cross. Carbon dioxide, oxygen, amino acids, and glucose can all travel across the blood-brain barrier by different forms of transport. Pineal masses typically manifest with symptoms of increased intracranial pressure as a result of obstruction of CSF flow by a space-occupying lesion. Pressure on the pretectal region of the midbrain may also result in Parinaud syndrome, a condition characterized by vertical gaze and pupil abnormalities. Subacute and chronic subdural hemorrhages can present weeks after the initial inciting event with progressive headache, decreased level of consciousness, and lightheadedness. Diagnosis is through non-contrast head CT, which would show a crescent-shaped hyperdensity. Lesions of the inferior frontal gyrus in the dominant hemisphere produce an expressive aphasia or Broca aphasia, in which speech is non-fluent but comprehension is intact. Contralateral paralysis of the arm and face with sparing of the forehead is common. Decreased intracranial pressure caused by hemorrhage, mass lesions, or edema can lead to herniation. Uncal herniation is characterized by cranial nerve 3 palsy, hemiplegia, and decreased level of consciousness. Neisseria meningitidis is a gram-negative diplococcus that is a major cause of meningitis and sepsis. It can result in disseminated intravascular coagulation, shock, and adrenal failure, which is called Waterhouse-Friderichsen syndrome. Lesions of the subthalamic nucleus produce contralateral hemiballism, which is characterized by sudden, uncontrollable, and wild flailing and flinging movements of the limbs on one side of the body. Decreased inhibition of the indirect pathway of the basal ganglia is the mechanism by which this occurs. Ornithine transcarbamylase deficiency is an X-linked recessive disorder of the urea cycle. A deficiency of this enzyme results in the accumulation of ammonia and carbamyl phosphate. Hyperammonemia is neurotoxic and characterized by lethargy, poor feeding, irritability, and vomiting. Excess carbamyl phosphate is shunted to the pyrimidine pathway and results in elevated levels of orotic acid. Guillain-Barré syndrome is an acute, autoimmune, demyelinating polyradicular neuropathy that affects the peripheral nervous system, usually manifesting as ascending paralysis, loss of deep tendon reflexes, and autonomic dysfunction, often triggered by an acute infectious process. Treatment involves respiratory support and intravenous immunoglobulins or plasmapheresis. Neurofibromatosis type 1, NF1, or von Recklinghausen syndrome is an autosomal dominant neurocutaneous disorder caused by a mutation in the NF1 tumor suppressor gene on chromosome 17. The presence of greater than or equal to 6 café au lait spots that are at least 5 millimeters in diameter in the pre-pubertal ages is considered diagnostic. Complications of subarachnoid hemorrhage include rebleeding, vasospasm, seizures, hyponatremia, hydrocephalus, and increased intracranial pressure. Vasospasm, leading to delayed cerebral ischemia, is the most common complication and often presents with new onset focal neurological defects 4 to 12 days after the initial subarachnoid hemorrhage. Purkinje cells send inhibitory GABA projections to the deep cerebellar nuclei, which are the sole output of the cerebellum. Alcoholic hallucinosis refers to the onset of visual, auditory, and tactile hallucinations 12 to 24 hours after consumption of the last alcoholic beverage. It is differentiated from delirium tremens by the timing of its occurrence and the severity of symptoms. The cerebrocerebellum or neocerebellum includes the lateral hemispheres of the cerebellum, which function in motor planning and complex coordination. Lesions of the cerebrocerebellum typically present with dystiochokinesia, which is inability to perform rapid, alternating movements, and intention tremor, broad, coarse tremor that worsens as visually guided movements reach their endpoint.